Hi guys, my name is Stephanie Chu. I graduated from UOP in 2015 and I was a double major in SLP and music. Now you may ask yourselves why I chose to complete 2 degrees in 4 years. But honestly, I liked both fields and I couldn't decide which to pick. After graduation, I didn't know what I wanted to study in grad school yet, so I took some time off from school to work. I started off as a SLP at San Francisco Unified School District, and then I transitioned to Aspire Public Schools in Central Valley, where I currently service 80 to 100 students, and I go to 6 different school sites. On the side, I give private lessons in music, and in this way I use both of my degrees. While working these jobs, I discovered that the skills required to be successful in both of the fields overlap with each other. For example, building rapport with a student and analyzing what their needs are. And as I worked at Aspire, I actually fell in love with the job, which led me to reconsider the SLP field. As I continued to gain experience, I realized I enjoyed the challenges and the critical thinking that a special needs caseload brings. The small wins that I encounter on a daily basis, such as when a student who couldn't produce a sound for months finally got it down, or when they made progress on their goal, really motivates me to come into work every day. Moving on to the 6-year-old boy, I would start getting out toys right then and start playing with them and talking about them, and eventually his comfort level should increase. At some point, I'd offer him a toy, but I wouldn't push it. I realized that it would take more than one session to adjust, which is completely fine. I would also see if this child responds to any wind-up toy or noise-making toys to get his attention and possibly turn him around. With that toy, I would manipulate it, such as putting it out of reach, so he has to initiate some type of communication to retrieve the toy back. And if it doesn't work, I would ask his parents what usually gets him engaged at home and then apply it to his therapy sessions. Another strategy that I found effective that I also do in the schools is to invite the parent to come in, and I would do speech with the parent for a few sessions until the child becomes more comfortable. In a school setting, I've done it the same thing with the child's one-on-one aid. Another solution would be to over-reinforce good behavior, like if he turned around, I would give him a star, and then if he sat at the table, I'll give him another star, and if he participated and did some work for 10 minutes, I give him another star, and so forth until he reached 5, and then at that point, I would give him a break of choice, like a little bit of iPad time or some coloring time, so that he would be incentivized to keep working. Lastly, why I feel UOP's program is the right one for me. First of all, the accelerated 15-month program appeals to me since I was already a SLP major in undergrad. This program would further hone the skills that I already developed while working as a SLP. I've gained a lot of clinical experience, and I'm ready to achieve more. I've already conducted therapy and screened tons of students for a few years now, and now I'm ready to do more. I'm ready to be able to assess students and use the data and observation to diagnose and devise goals for them. I'd also like to observe other settings, such as a hospital or a skilled nursing facility, and work with adult clients. That's something that I haven't worked with before, and I would like to gain that experience to work with those types of clients. As for UOP specifically, the small class sizes and the exceptionally supportive faculty that I have worked with in the past 4 years would be a familiar environment for me, and that learning environment would suit me very well. Having mentors that are familiar, such as Dr. Ward Lonergan and Dr. Bowles, who serve as familiar role models to me, would be a perfect addition to my graduate program. That's it. Thank you for listening, and I hope to see you next fall.